Hello and welcome to the program today. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. You know, blood shortages are rampant, and they happen when more blood is distributed to hospitals faster than blood donations are coming in. Our guest in studio today is Mr. Joseph Thomas, registered nurse, and he's here to discuss with us this current blood shortage in the United States and the excessive use of blood transfusions. Welcome to Health Professional Radio today, Joseph.
Thanks for having me, Neal.
Thank you. Do you prefer Joseph or Joe?
Joe would be fine.
Great. Now, you're a registered nurse. Tell us a little bit about your background. How did you become interested in nursing?
Yeah, actually, I have to blame my mother. It was either becoming a cook, a carpenter, or going into healthcare. And she made the decision for me when I was pretty young to go into nursing school. So it worked out pretty well for me, but I'll either blame or give her all the credit.
Well, giving her the credit is probably the best thing because, as I understand, you've made quite the career as a nurse, especially as it pertains to Acumen. You're one of the directors, right?
Yeah, that's correct. You know, it's one of those funny things, and I'm sure a lot of physicians and nurses can attest to this, that sometimes rather than choosing a career or a path, it chooses you. And so without trying to come off too morbid up front, you know, I've always been fascinated by blood. And if you think about it, all of us are inundated so often with this concept of blood as being this mystical, powerful substance. If you look back at history or religion, even modern society, it's the gift of life, or it's patriotic to give blood. So again, I'm sure we'll talk for a moment about it, but I was sort of cast into this path when I was at the Cleveland Clinic and given opportunity that I really haven't sort of turned back on and have just ridden out over the last 14 years.
How is Acumen addressing this current blood shortage?
Well, you know, there's always shortages with blood products, whether it be just with a specific blood type or a specific blood product. And if you think about it, it is a resource that always depends, obviously, on donation to be maintained. So it's not an unlimited resource. Certain times of the year, like summer, where maybe businesses or schools aren't collecting as much. So again, in that summertime now in the United States, but also certainly at times when we have events such as the one that we're facing today with the Zika virus, which has certainly raised the hair on the back of many of our necks in this sort of blood management world. We've actually had to shut down donation in certain parts of the country because of fear of Zika transmission. Wow. So all of these things, including just the donor restrictions that we have, if you go to certain parts of the world, you can't donate blood when you come back, and we're all a very travel friendly world. It seems like so often we have blood shortages based upon some of these events. The last thing I'll say, though, that's causing some of this is simply a shift in how we're utilizing blood. So part of the work that Acumen does, and certainly work that's being done internationally, is an effort to reduce the utilization of blood products. And I know that'll be a big focus today. But as we've seen a pretty significant reduction in blood use, our blood providers have had to readjust how much they collect. And so we're at that really kind of funny point where they're still trying to adjust to a 10 or 20% reduction in utilization. And it's leading to some of these issues today with having appropriate amounts of donation and collection. So again, a long answer, but all of that leading up to, again, some of the worst blood shortages we've seen in a while. And again, Acumen's work is to help hospitals really utilize blood products in a more efficient, safe manner and ultimately reduce the need for transfusion, which is great for community, for the hospital, and also, and most importantly, the patient.
Now, in light of this, this huge shortage that you say happens from time to time, how do you have an excessive use of blood transfusions? If the word is out there that we're in a shortage, you're talking about the management of blood, using blood products efficiently. But why do you think that there is this excessive use of transfusions, especially in light of such a shortage?
Yeah, no, I think that's a good question. So it's a complicated answer, and I guess let me start with somewhat of a provocative statement. I believe that patient blood management, that the safer and more evidence-based use of blood products is one of the 5 most important patient safety initiatives this decade, period. And why I believe that is sort of alluding to what you just said. The evidence today that has been published shows that probably in the range of 40 to 60% of blood transfusions, and that is an astronomical number when you consider 20 million or more transfusions are given every year in the U.S. So let me go back. 40 to 60% of transfusions are either unnecessary, excessive, or avoidable. And I know that's a crazy statistic, Neal, but it's huge. That's millions upon millions of blood products. That's billions of healthcare dollars. And ultimately, and what I think scares me the most is which of those transfusions that patients were exposed to may have actually contributed to harm that were unnecessary. And I'm sure we'll talk a little bit about what drives this unnecessary use, but it's a crazy statistic, and actually one that I will stand behind today. I almost didn't believe years ago, but as I've worked, and I've had the chance to work with over 160 hospitals across the United States on this patient blood management effort, I often see hospitals reducing their blood utilization by 30, 40, 50%, some even 60%. So the fact is, if it wasn't avoidable or unnecessary to begin with, how are hospitals reducing their use of blood by these, significant percentages? Well, again, it reinforces that I think every hospital in the United States, depending on where they started, has the opportunity to reduce their utilization of blood probably in half.
Let's talk about briefly at least one factor that's driving this excessive blood transfusion epidemic.
Well, let me quickly state 2. And only because it's so important to cover the both, but I'll keep it brief, Neal. And one is lack of formal education and training, the lack of evidence-based guidelines and oversight, and the fact that, Neal, the guidelines have changed really over the last few years, and many physicians and nurses, it's so hard to just keep up with all of the evidence. So merely not keeping up with the new guidelines for transfusion as they rapidly shift. And I think 20 to 30% of overuse is simply due to inappropriate use. But the second piece is so important, Neal, and that is that probably 20 to 30% of transfusions are avoidable. This means being proactive versus reactive. Sometimes it was the right thing to do to transfuse, but there were so many things that we could have done prior to the transfusion to avoid it, whether that be better management of an anemia before a major blood loss surgery, whether that be, again, drawing less blood off of our ICU patient, which then resulted in anemia and transfusion. So it's that proactive piece that many hospitals today aren't yet really focusing on. And those 2 things, again, lack of education and training, guidelines, oversight, and then a kind of a lack of a systemic approach to be proactive, to put in place all of these strategies to prevent anemia or prevent bleeding. Both of those together lead to that 40 to 60%.
And wrapping up, where can our listeners get more information about Acumen?
Well, acumen.com, certainly, we can be Googled. I think it's an amazing organization that today is working with approximately 70 hospitals across the country of the United States to help accelerate this effort around patient blood management and implement truly a world-class patient blood management program.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Joseph Thomas, discussing this current blood shortage in the United States and the excessive use of blood transfusions. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.